ones, which are divided into sterile OT complex and ultra sterile OT complexes. But not all of us will have a career path that we will work in such institutions and might be having a standalone unit or maybe a nursing home. So my talk is actually structured according to that any strata of OT at least have your basics in place. Whichever subspecialty you do, that's fine. But for orthopedics, like Professor Tuli said, it's a biological tissue handled with care, and the environment should be helpful for the same. Because if you have such a picture in front of you, it really causes anxiety to the surgeon, to your family. It affects your image, regular working, and it has medical legal consequences. So this is just a line taken from Peter, that prevention of infection in the OT room is not only dependent on the procurement of equipment or mechanics, but on the discipline. And that is exactly what I'm trying to pass as a message. And good techniques are always good to learn. So I've divided this into the areas where we can work on to reduce the infection. Optimization has already been covered, so I'll start with the OT structuring. I've picked up some references from the last year's ICM. So in OT structuring, this is the zones that you should have. The outer protective zone. Now why I brought this slide is, if we are having a smaller unit, you might not have these zones so clear, but you can add doors, you can add some barriers so that it does not, your OT door does not open directly into an open corridor. You must have a protective zone, a middle clean zone, an inner sterile zone, so that all personnel reaching the sterile zone are in OT attire. There are places where we visit where the CSSD or the sterilization room is just the most deep inside and the technician's room is next to it. And most of the times they are walking in and out. Why will they change? So that is important. Secondly, your disposal corridor, and that should be a clear zone demarcated. All youngsters are with this term modular operation theater. What does that include? The modular operation theater has these components: the laminar flow with the filter. It should have seamless SS walls, both up to the roof. The floor should be anti-static and sealed. No tiles, no crevices. Preferably, there should be pendants so that your suction machines are not going in and out. Roof lights should be attached, and preferably there should be automatic doors. We have these days doors, mechanical doors. You don't need sliding doors. Even closing normal doors can have very, very heavy duty door closers. So what is the laminar airflow? When the air movement is smooth or in layers, that is laminar airflow, non-turbulent. And this was picked up first time in 1960, not for medical reason, but Sir John Charnley, ये चल नहीं रहा है. Yeah, now it is working. So he made this first attempt to transport the laminar flow system. It was a very, very sort of a makeshift arrangement, and he found that if you are using a HEPA filter and you are trapping the very, very small bacteria, viruses, you are also having a unidirectional airflow and you are having a positive pressure air from the OT moving outwards. This should help reduce your infection rate. So this was the recommended value for the positive pressure, and this is the value for the number of air exchanges per hour. So different types of HEPA filters are available. The bottom right is used for our OT, and this is a very, very swanky structure which you can see. You have the air inlets on the bottom which are sucking in air, the orange air, then they go up through the HEPA filter and the positive pressure pumps that is pushed down. I just took a rough cost The local market ones are coming to the tune of around 70 lakh, which includes everything, including OT lights. The ones which are in corporate hospitals go up to 2.5 crores. With other all efforts for infection control, this has shown to show some improvement in the wound infection rates. But they can fail. You put in a Laminar Flow, but you block its inlets, it is not going to work. If the HEPA filter has not been maintained, it is not going to work. If there are heat sources around, again, it is not going to work. And if the patient has not been optimized, it's of no use. So it is not a panacea that हमने laminar flow OT में किया, हमारा patient ठीक ही होगा, nothing like that. So the second thing I picked up for this talk was the equipment sterility, which we as orthopedic surgeons are hardly aware of. I went to my own CSSD at Apollo and asked, क्या कैसे होता है? There are separate areas for washing. High pressure jets are there so that there are no bone residue left on the implants. Trays are properly packed. I don't mind using cotton, but the sheets should be nice and thick because orthopedic trays sets are heavy. They can cause a little ripping off. At Apollo, we use these SMS sheets. They have shelf life of months. All packs should be double pack. The sterility can be done by autoclaving or by ETO. The ETO cycle is 8 hours. It should not be sped up and it should be kept so that the ETO gas, which is very toxic, escapes for 72 hours is the recommended. The faster one, which is the plasma steroid, is quicker and can be used at, but it's very expensive. Formalin chambers and Sidex in orthopedics should be discouraged as much as possible. Even arthroscopy. These are the indicators which are applied to either each set or the daily checks which are done in big hospitals definitely, or biological also, or all of them together. This gives you extremely good autoclaved sets which must be stored positively in positive air pressure, proper racks at a good humidity and temperature. The non-sterile store should be separate. The surgical team preparation, you must have a good attire, the correct boots, the correct mask. You must ensure that your hair are properly covered. This is something new. Yes, it is convenient for the surgeon. It has not been shown to cause any improvement in the infection rates. A surgical scrub should be properly done. When you are establishing a OT, a scrub station is an inexpensive and an important thing. Despite this, obviously your hands will not be sterile. Gowns should be all wrap around. It might be cotton or disposable, not important. You must maintain that you are holding your hands up. We have a practice sometimes that we are keeping our gloved hands in the axilla. It is to be discouraged. Maximum you can keep it like this. Don't shove it into your axillas, right? Because the sterile is only your front shoulder to your waist, not otherwise. Gloves, we have various types. Preferably it should be double gloving as recommended by the ICM, that it should be 2 gloves so that you can know if there is a perforation. At the same time, we work with sharps. You must keep changing your gloves, especially before using your final implants, right? It usually does not affect the dexterity. As a rule of thumb, if your size is 8, the inside glove you can wear a little looser and the outside glove can be 8, so you will not lose your dexterity. How about the skin preparation? So alcohol-based first skin preparation is to be done. Scrubbing, painting are shown to have the same amount of effect. These adhesive drapes are not having any great advantage except looking neat. No contamination, we use regularly, but they must be applied after the skin has fully dried. So if you have to do a skin prep, it has to be alcohol, then aqueous, and then again some alcohol which evaporates so that your plastic drapes can properly attach. These can be either thick linen, just few slides, or it can be disposables. They are convenient that they seal it off, right? This is the sterile area. We must ensure that our drapes are down at least half of your trolley, not just at the edge. Secondly, anything which is crossing the edge is to be discarded. Sometimes our suture or our retractors are on the edge. They must be discouraged and discarded. And all these things put together, it has to be a good OT discipline that the moving in, moving out, and the amount of times the door opens should be regulated and discouraged. Who has come inside should stay inside. Who is outside should stay outside. People keep running in and out because you at the end of the day want a super hit blockbuster. Thank you.